Hello, welcome back to the virtual classroom, students. In previous lecture, we have talked about the entamoeba histolytica, its morphological stages, it is minuta, magna, then cyst formation, that is precyst, cyst and metacyst, and how metacyst, then we have seen the life cycle. In that we have seen how the metacyst enters into the body. It is protected through the stomach, small intestine, and then when it enters into the large intestine, at that time it comes out, 4 nuclei comes out, or that process is called as excistation, okay, in which the organism come out, initially 4 nucleus, then 8 nucleus, then suddenly the 8 nucleus separate, then you have trophozoite stage, metacystic trophozoite stage, and the minuta formation is there, and in that formation, and that may lead to either minuta will get converted into the metacyst, or at the same time it may get converted into the magna form. Magna form infects the intestine, damages the intestine, may enter into the bloodstream and go towards the liver or any other organs, lungs, brain. Okay, so we have seen all these things in previous lectures. Now today we will see that what exactly happens when this particular organism is present in the body of host. It is also called as pathogenicity. In your syllabus it has been written pathogenicity of the organism. So effect on host is also called as a pathogenicity. So what exactly happens here when it is inside? As we have already seen, the minuta form is not asymptomatic actually, and it doesn't show any effect on our body. But other than that, if it starts some problems within the body, their number increases, then they become pathogenic in nature. So initially they are common cells, but later they become pathogen, and that damages our body. So what exactly happens, or what symptoms a person shows? Okay, so some hosts provide conditions suitable for the production of virulently invasive magna form. So after entering in some of the host, directly magna formation starts along with the minuta, okay, and such person exhibits a variety of clinical manifestation, and that disease is called as the amoebiasis. Now it's a puzzle feature of entamoeba that only some persons seem to have adversely affected by the parasite actually. So all getting very adverse reaction? No, some of them, some are unaffected, some of the carriers, okay, some hosts are only carriers, they are unaffected and serve as a you can say disseminators or infection metacyst, and are therefore of the immense public health importance. So that can be the problem for some of the hosts. Now when the magna form trophozoites are solely primarily responsible for producing initial lesion, remember, so magna stage is the stage which is responsible for actual diseases, not the minuta stage. Remember, minuta stage may have some effects, but magna is the main one. So magna form trophozoites are solely or primarily responsible for producing initial lesion, that is a pathological change in the host intestinal mucosa. So we already know that it start eating, it will secrete the enzyme, some proteolytic enzyme, collagen proteolytic enzyme, which collagenase, which will degrade the collagenase, enters into the tissue, start eating the tissue itself, debris of the tissue. Okay, now they may enter and subsequently aggravate the injuries. So what will happen? So because not one, then more than one. Actually, there are many these magna forms. They'll start eating or damaging the intestine. Okay, so this will increase. Now there is one more thing. There is a possibility that if within the intestine you have a damaged area, now that area may again increase, or it will aggravate the injuries further. Okay, which may have been caused by other bacteria also. So the person who is already having an infection, suppose, and at that time suppose the magna is present in that person's body, then there is a possibility that his injuries will increase, aggravate it will increase. Okay, so in any case, the magna will feed upon the exposed cells and enter deeper into the intestine and go towards the capillaries area. So lamina propria and submucosa layers can also be damaged. So eventually this produces localized coagulative necrosis. Remember what all this process will lead to what? Coagulative necrosis. Localized means where exactly the damage has happened, localize that area. Okay, so coagulative necrosis and formation of abscess, okay, which finally ruptures, giving rise to a flask like ulcer. So this stage or this magna, that will lead to the formation of flask like ulcers within the intestine. Okay, and a part of this condition is called as the intestinal amoebiasis. There are two terms here. We will talk about the second term also. This is the liver amoebiasis. Okay, but here first thing, when ulcer appears, if a person is having these ulcers within the intestine, that is called as an intestinal amoebiasis. So the term amoebic dysentery implies that infection is confined to the intestine and is characterized by low fever. So what will happen? He will have the low fever, urgency for defecation, there will be ineffective bowel movements, intense colicky pain and passage of blood and mucus in the dark colored stool. So stool observation, when it is carried out, in that a lot of mucus will be there and it will be a dark colored because the blood clots, blood will be present in that area. Okay, so in the stool you will have the blood and mucus and its color will be dark color. You will have, that person will have pain, ineffective bowel movement, okay, and low fever. Possibility of low fever can be there in amoebic dysentery. Okay, so these ulcers are actually restricted to the large intestine area, not the small intestine, remember. But if they become deep, intestinal blood vessels may rupture, and extreme case the intestinal wall may also become perforated. This is one of the problems that may happen. So one more thing about the stool. Stool maybe it will be a fluid like semi-solid, very rarely it will be solid. Okay, now it is passed several times a day in a usual mild cases, alternating with the constipation occurs and there is a abdominal pain of variable intensity. Okay, so these are some of the symptoms that happens in the intestinal amoebiasis. Furthermore, there is a possibility that it's a curious case or curious aspect of amoebiasis, that person with amoebic dysentery rarely present hepatic complications. Remember, we are talking about only the intestinal amoebiasis. There is another term that is called as the hepatic amoebiasis. So if this particular magna form enters into the blood through the capillaries and get transferred in the liver, now there you will have some other conditions, and that is called as the hepatic amoebiasis. So if this particular entamoeba histolytica start infecting the liver, then that particular part is called as a hepatic amoebiasis. So this hepatic amoebiasis is seen in just 5 to 10% of the infected persons actually, very rarely. So in this case, magna forms get carried through the intestine up to that area. Okay. Now what they do in liver? So this amoebae will multiply due to their histolytic activity, gives rise to hepatic abscess. What is this abscess? It is a Latin word, localized accumulation of pus produced by pus forming organisms. Remember, so there will be damage to the tissue. Definitely this damage will lead to the localized accumulation of pus, this which is produced by the pus forming organism, and this is abscess. So hepatic abscess will be observed initially. Parasites found in large number only in vicinity of healthy tissue. Remember, wherever you will see the abscess, once the abscess formation is there, the parasite will not utilize any of the part of the liver from the abscessed area. It will start infecting other parts which are actually healthy. Remember, so you may not find see the large number only in the vicinity of healthy tissue, at the periphery of the abscess, and never within the dead tissues of the pus. Remember this thing. Okay. They will not go in that area, they will start infecting other fresh cells only. So this may reach a size of several centimeters, in extreme cases entire liver. Very rarely this happens that whole of the liver is actually infected by this particular organism. If such thing happens, then whole of the liver form a huge abscess sac, means within the liver lot of dead tissues will be there and pus formation will be there, at least holding a thick chocolate brown odorless pus. Okay, and this generally the person who will enter into this condition, he will die, because if liver doesn't work properly, the person dies. Okay, so this will be the one condition, very extreme condition. So this happens. This hepatic amoebiasis is also characterized by, at the same time what will happen, there will be high fever, pain in the shoulder tip and the liver areas, tender liver elevation site. So how there will be the swelling on the liver. So the doctors will check by finding out whether swelling is there or not. Definitely will have pain. So that this is one of the condition. So right side of diaphragm, elevation of right side of diaphragm and non-productive cough will be there. Okay, and then histolytica cause inflammatory pathological changes also in infected person. There will be a conjunctiva or cornea retina infection can also occur. Okay, often pale, lethargic with lustreless eyes. The person who is infected will have the pale, lethargic and lustreless eyes, or he will not feel any energy because liver is extremely damaged or liver is having some problem. Okay, so this is the another part. In previous one we have seen intestinal amoebiasis, this is the hepatic amoebiasis. So question may be asked on both, either on intestinal or hepatic or both. So what exactly they do? But remember one thing, both things are actually carried out by the magna form trophozoite, not the minuta form. Remember, minuta is not damaging, magna is damaging. Now how the diagnosis is carried out? So these are the initial symptoms. A person will go towards the doctor and doctor will tell some test that diagnosis is required. So the person will go for the diagnosis. Now in diagnosis what they do, large intestine generally, that is also called as a primary amoebiasis, occurs in the large intestine. So this is first in, is called as primary amoebiasis, and if the infection is in tissues, especially in liver or lungs, there will be secondary amoebiasis, or also sometimes called as a metastatic amoebiasis. Okay, but the problem is the diagnosis is important. Reason is, For the intestinal treatment, there are different combination of medicines, and if it goes towards the liver and lungs, then there is another type of means their combination of medicines will be different. That's why diagnosis for the treatment is very important. So for primary amoebiasis, what kind of diagnosis is carried out? Diagnosis means finding out exactly what is the cause of the person's problem. So stool examination is the first thing in the diagnosis. Intestinal amoebiasis, so any person, the symptoms already know that amoebic dysentery is there. Its stool will be dark colored, okay, dark red acidic stool, okay, containing blood and mucus. This is the first symptom that will be observed when the stool sample will be taken. Microscopically, there will be staining will be carried out. In this staining, they will try to observe the trophozoites, bacteria, okay, eosinophils, but few macrophages and pus cells are also present. But basically, they will see the trophozoites first of all. Then another thing you may observe within the stool, that is the presence of cyst, okay, metacyst. The stools particularly valuable for detection. So basically, people don't go for blood sampling or blood testing. People go for stool testing if the amoebiasis is there, okay. And generally the first thing is, if the stool is acidic, if the stool is having blood and mucus and person is going for dysentery for so many times, then definitely they will go for stool analysis, okay. Blood analysis will not be carried out. Very rarely, if a person is having some liver or lung based infection, at that time there is a possibility, but you may not find it, okay, that much number. So this is what happens in diagnosis. Then you have a person suffering from intestinal or orally administered drug. These are some of the drugs, okay. Dialoxagnide, furoate, okay. Safe drug, directly on the luminum submucosite. Its main action is on the intestine. Then metronidazole, okay, this is also safe drug. And some antibiotics are also given at the same time. Different antibiotics are there. Tetracycline is there, and erythromycin are there. Along with this, one more is there, hydroxyquinolones. We already know that hydroxyquinolones is used against the Plasmodium vivax, okay, but the problem is it is highly its side effects are too much. So nowadays people don't give it, okay, because of its toxic effect. But there is no drug for the cyst stage. So basically they don't target the cyst stage, they will target the magna form, okay, and try to kill it. So these are the antibiotics and some of the medicines that has been given. Along with this, now we will talk about the secondary amoebiasis, okay. Now this is the stage, as I have already told you, that very few person get it, 5 to 10% person, okay, and this happens when initially too much of infection has occurred and people are not looking after it. Some people, they don't take medicines. At that time there is a possibility that this will aggravate, it will increase. So identification of hepatic depends upon the clinical signs. Now here specific modern immunological methods are used, remember, okay. Specific indirect fluorescent antibody test. Now here you can see antibody test is used in the first one, IF80, then ELISA is also there, and then you have the counter current immunoelectrophoresis and indirect hemagglutination test, okay. So these are how you will come to know from blood, so whether the antigens of that particular organism is present or not, that is carried out. And fluorescent antibody test means the antibodies which will there will be a specific antibodies which will attach to the antigen of that particular organism. So if that organism is present, there will be fluorescent, the antibody will attach to it and it will be detected. Okay, fluorescence will be detected. If a fluorescence is not there, means the antigen is not there. In ELISA also the similar thing is there. Only thing is the plate, on the plate they will have the antibodies, then you will have the antigens. The antigen will bind to the antibodies, and on those antibodies there is a possibility of another antibody. So it is called as a sandwich ELISA. Okay, this is one of the possibility, and then there will be detection. So color change happens, then it's a positive test. If color change doesn't happen, there is a negative test. Counter current immunoelectrophoresis, in this what will happen, within the gel you will have the antigen or maybe the antibodies also, and at this time what will happen, there will be electrophoresis. So antibodies will be present, so you will use the serum where antibodies will be present, or otherwise it will be in gel. So you do the electrophoresis and you may see the precipitine lines. If precipitine lines comes up, then it's a positive test. If nothing comes up, it's a negative test. So in counter current immunoelectrophoresis is there, then indirect hemagglutination tests are there. So there are so many tests these are specific modern immunological methods, and these are very effective and gives you the proper result. There is another test, that is the confirmatory non-invasive techniques, okay, which includes ultrasound, computerized tomography, ultrasound and scanning. The scanning electron microscopy is also there. Okay, so see, this is a mistake. This is a mistake. So don't go for this. Okay, this is a mistake. So what happens here? Ultrasound or that thing, they will scan your. Once you get this kind of results, they will scan the abdomen also. So in liver, whether the enlargement of liver is there or not, the size changes. So this CT scan or ultrasound gives you, tells you about the size of that particular liver, and that also confirms whether you have infection or not. You will also come to know with the help of CT scan that whether you have the lesions or not, so whether the pus formation is there or not. So that all can be detected. So this is diagnosis followed by the drug administration. So drugs will be given. So what kind of drugs? Some alkaloids are there as shown. Okay, treatment for acute hepatic amoebiasis. Then you have a metronidazole, acts as a magnaform in the liver and other tissue, and you have chloroquine. Okay, so these are some of the drugs that is used here. So how to control this? This is all about the primary and secondary detection methods. Now how about the control and how to stop the infection? Okay, this is very important. So it can be managed and often cured by treatment with appropriate therapeutic measures. So what kind of measures we should have? And these measures not just on the individual level but at the large scale or population level also. So this part, this effective control, is called as a prophylactic. So we will have the two type of prophylactic, means control and prevention. Personal prophylaxis, and another one is called as a community prophylaxis. So prophylaxis means for effective control or preventive measures. Remember this thing. Okay, so in question in exams they may ask you, tell about the prophylaxis, personal prophylaxis. So prophylaxis means what? Effective control to prevent this disease. So what you can do is careful washing your hands with soap. Now after the corona epidemic, we are washing our hands continuously, and at the same time we are having sanitizer also. Sanitizer is also very much effective against this, but soap is much better than the sanitizer in this case itself. The reason is, if on the hands you have that cyst, okay, that metacyst, Then metacyst, as we already know, have a cyst wall which is very thick and it is not degraded by the ethanol itself or the hand sanitizer. So washing by soap is the best way you can protect yourself. Okay, washing after using toilet and before eating food. If you are working in the field, remember soil may have these metacyst, moist soil especially, so you have to wash your hands. Okay, then use only clean household utensil. Always boil the water. We do have a very good drinking or good water facilities nowadays. Everybody is having RO or water purifiers, so those are good one for filtering purpose. Okay, so use this, or those don't have it, then boiled water is there. Chlorinated water can be used. Okay, hypochlorite is used many times for this part. So avoid untreated raw vegetables. See, if you are taking vegetables from the land directly, it is good, but you should wash it properly, okay, before eating raw. So especially the potatoes or the tubers, I should say, and that carrot is there. So whatever tubers are there, you should clean it first and then eat it. Okay, also very important, protect the food and drink against contamination by flies. So always cover the food. Cockroaches should not be there too much in your house. They may also actually carry the metacyst everywhere. Flies, they fly. Even flies are more dangerous than cockroaches because they can fly, they sit anywhere and they come back and sit on your hand or on the food. So you have to protect it. Since prevention is better than cure, so stopping the infective cyst from reaching the host, that is the best thing. We cannot see that, we cannot directly damage it or nullify it. So only thing we can prevent it. Another one is the community prophylaxis. Now in our India, or we Indians are quite conscious about the personal hygiene. That is for sure, because if you look, since from so many years we are having one very good hygienic practices. That is, if you look at your ancestors or even today also, if you are coming out from any area, you come inside, you always wash your hands. आप लोग अगर पुराने ज़माने में देखोगे तो हर घर के बाहर पानी रखा हुआ करता था और जो भी आते थे वो हाथ और पैर धोया करते थे, उसके बाद ही अंदर जाते थे. सो दिस वाज अ वेरी गुड प्रैक्टिस एक्चुअली, एंड स्टिल इट इज़ देयर. आज भी हम घर पे जाने के बाद हाथ या पैर धोते हैं. आप अपने पेरेंट्स की तरफ देखो, पुराने लोग देखो, आज भी ये प्रैक्टिस है. सो वी इंडियंस आर क्वाइट गुड एट द पर्सनल हाइजीन, बट वी आर हैविंग सम प्रॉब्लम एट maintenance of public sanitation was not there. Now today government has gone through for the worked on the Swachh Bharat Abhiyan. We are having all that open sanitation that has been closed. Okay, lots of toilets has been constructed. That is a good sign, because community prophylaxis includes this. So installation of good water and cleaning supply. Another thing, water supply should not be mixed with the sewage tube pipes. Reason is they may get mixed up if there is a leakage. Okay, cross contamination may happen. Then effective disposal of sewage, that is also important. Directly sewage should not be transferred into the water bodies. That is also important. So to improvement of all these basic sanitization parts, facilities, that may also will stop the disease. Okay, do not use the human excreta as a fertilizer for crop directly, and educating people about it is very much important. So this is all about the actual community prophylaxis. Okay, so this was about the Entamoeba histolytica. We have finished this part. From next part we will start with the Ascaris lumbricoudes. Okay, thank you.